This video provides an overview of the Medicare Diabetes Prevention Program, or MDPP, to organizations interested in becoming MDPP suppliers. 25% of Americans 65 and older have type 2 diabetes. This costs the nation about $205 billion each year. Medicare pays most of this cost. Without intervention, many people with prediabetes could develop type 2 diabetes within 5 years. This puts them at risk of serious health problems, including heart attack, stroke, blindness, kidney failure, and loss of toes, feet, or legs. MDPP works to prevent or delay type 2 diabetes among people with prediabetes. Medicare enrolls qualified organizations to provide MDPP services over a one-year period. These organizations, referred to as MDPP suppliers, provide MDPP services to eligible Medicare patients. Before enrolling, interested organizations should know that MDPP services include up to 12 months of sessions provided to groups of eligible Medicare patients. As a Medicare preventive service, there's no out-of-pocket costs. Sessions follow a CDC-approved curriculum and offer coaching in dietary change, increased physical activity, and weight loss strategies. Coaches provide MDPP services on behalf of an MDPP supplier. This is done in community and healthcare settings or remotely through distance learning. Coaches can be suppliers, employees, contractors, or volunteers. MDPP suppliers get payments from Medicare when eligible Medicare patients attend sessions and when they achieve performance goals. Suppliers can get payment for Medicare patient attendance, and they can also get performance payments for weight loss. Organizations interested in providing MDPP services should be aware of 3 conditions for providing services. First, Medicare patients participating in MDPP don't need a physician referral. However, they must meet eligibility criteria to get MDPP services. Second, to get payment from Medicare, MDPP suppliers must submit claims through Medicare Administrative Contractors, or MACs. These claims follow standard CMS procedures. Finally, MDPP suppliers must follow the MDPP-specific requirements for services and Medicare patient engagement incentives. These requirements are in addition to other applicable Medicare regulations. To provide MDPP services and get payment, organizations must enroll in Medicare. Organizations can enroll online through the Provider Enrollment Chain and Ownership System, PACOS, or by submitting a paper enrollment form. If your organization is interested in enrolling as an MDPP supplier, there are steps you can take now to prepare for enrollment. Interested organizations should get a National Provider Identifier, NPI, begin gathering required enrollment application information on the CMS 20134, learn about MACs that process Medicare enrollment and claims, and learn about the enrollment process options, including enrolling online through PACOS or submitting a paper enrollment form. Organizations planning to enroll online using PACOS should create an Identity and Access, or INA, account. This isn't required if the organization is planning to apply using the paper enrollment form. To enroll as an MDPP supplier, organizations must have preliminary or full CDC recognition through CDC's Diabetes Prevention Recognition Program, have an active or valid tax identification number TIN and NPI, have a list of MDPP coaches who will lead sessions, as well as their NPIs, and meet both Medicare provider requirements and MDPP supplier standards. Note that if an organization is already enrolled in Medicare, they must re-enroll as an MDPP supplier. For more information and resources on MDPP services, please visit http://go.cms.gov/mdpp-exp or email mdpp@cms.hhs.gov.
This educational product was prepared as a service to the public and is not intended to grant rights or impose obligations. This educational product may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. The Medicare Learning Network, MLN Connects, and MLN Matters are registered trademarks of the U.S. Department of Health and Human Services, HHS, paid for by the Department of Health and Human Services.